Hi everyone, welcome to Clinical Pharmacy and Beyond. In this video, we want to discuss this prescription which is probably administered for a patient with some kind of ischemic heart disease or coronary artery disease considering his medications. First one is metoprolol, which is a selective beta-1 blocker. This medication is much useful for the management of patients with ischemic heart disease. It actually reduces the heart rate, induces the bradycardia. All this process leads to decreased oxygen demand of the heart muscle. However, you should note that metoprolol's cardioprotective effects will not last for the whole 24 hours if it's administered just once daily. As you know, QD here means once daily. Metoprolol, considering its short half-life, should not be administered as once daily dosing. So, metoprolol twice daily, we're good. Second one is isosorbide dinitrate or isdn or isdn, which is a medication from the nitrate family. This medication is also much useful for the management of patients with ischemic heart disease. It actually reduces the chest pain. However, the main point about this medication is its TDS. You know that TDS means 3 times daily. However, in case of nitrate medications, TDS should not be translated into every 8 hours. Why not? Because we should have 12 hours in nitrate-free interval when administering a medication from the nitrate family to prevent tachyphylaxis. Tachyphylaxis reduces the nitrate medication's effectiveness. So, TDS here should not be translated into every 8 hours. We can administer this, for example, 6 a.m., 12 p.m. and 6 p.m. In this case, we have 12 hours nitrate-free interval, we're good. The second one is Lipitor or atorvastatin. It has a very long half-life. It can be administered as once daily dosing. This one is a lipid-lowering agent or mainly cholesterol-lowering agent, which is much useful for the management of patients with ischemic heart disease. As you know, the main culprit for the pathophysiology of the ischemic heart disease is accumulation of the lipids in the coronary arteries. The last one is aspirin 81 milligrams once daily. QD means once daily. Aspirin can be administered as once daily dosing. It's actually capable of being administered once daily because of its long half-life. However, you should note and be warned about its gastrointestinal issues when administering this medication to someone older than 60 years old. You should administer some kind of proton pump inhibitor with it, like omeprazole or pantoprazole, to prevent its gastrointestinal issues. Hope you enjoyed this video. Please like, subscribe and share. Thanks.